Global health, security and environmental experts, policymakers and researchers in various fields have again converged on Lagos for the 9th African Conference on One Health and Biosecurity. The conference is to see that Africa is not left behind in the area of biotechnology. Senior correspondent Adedoja Salama Dini has more.
It is the smallest state by landmass in Nigeria, but also the most densely populated. This exposes the state to biosecurity shocks. These health experts are converging on Lagos for the 4th time to discuss emerging issues in the area of biosecurity. Nigeria, and especially Lagos State, had experienced infectious diseases from monkeypox to Lassa fever, Ebola virus disease, and COVID-19. Yet, scientists' predictions for the future are not encouraging.
We have a 40% chance of another magnitude, of another pandemic of the magnitude of COVID happening within the next 25 years, and there's a 25% chance of such magnitude of COVID happening within the next 10 years. But it's just for us to continue to prepare.
Not only that, this gathering focuses on emerging technologies such as gene editing, synthetic biology, among others. And the best place to start the discussion in Africa is Lagos State.
Now, synthetic biology has found the cure. What they've been able to do is to go into the cell of a child with sickle cell and switch on a type of hemoglobin that the child had when they were very, very young and inside their mother's womb. This is an example of genetic manipulation that we are going to be performing on human beings in the next few years.
Synthetic biology is like making life, artificial life, or altering biological systems, plant, animal life, or even our own life. With this technology, over time, we'll be able to cure almost any disease, prolong life.
Lagos State government says it's committed to always safeguarding residents of the state from security threats, be it physical or biosecurity.
There is no justification for any government to appear now ill-prepared to meet the need of its citizens, especially during emergencies. This informed our decision to establish the Lagos State Infectious Diseases Research Institute. The institute will support the development of new treatments and vaccines and train the next generation of researchers and clinicians to combat infectious diseases.
This conference is not only to see how Africa can work with other countries to maximize the benefits that come from emerging biotechnologies, but to reduce the challenges that come with it as much as possible. Adedoja Salamadini, TVC News, Lagos.